Mental health in the European debt crisis. What is being done? What is the European debt crisis? For some background knowledge, the European debt crisis involves multiple countries in Europe who have an overload of debt and their economies are on the brink of collapse. Some countries have too much debt for the size of their economy, which could lead to issues for all countries in Europe. PIGS refers to Portugal, Ireland, Italy, Greece, and Spain, who are all having the most difficult time from the debt crisis. The issue resulted from borrowing too much money and taking advantage of all interest rates available to all European members. The current economic situation from the European debt crisis has caused a decline in the economy. This has led to a rise in unemployment, depressed housing market, and increased people living in poverty. A big question is, what do we know about the economic crisis and mental health? Based on consistent research, mental health problems will increase during an economic crisis. The more debt people have, the worse their mental health is. Unemployment is associated with an increase in mental health problems. And fear and insecurity related to anticipation of unemployment is related to health problems. Research has shown that the current economic crisis has led to mental health problems, especially in Italy, Greece, Spain, and the UK. The amount of risk factors and protective factors after an economic crisis can influence mental health issues. Examples of risk factors are alcohol or drug use, job security or job stress, unemployment, poor nutrition or abuse, poverty, or high debt. Examples of protective factors are social capital, welfare, protection, healthy childhood environments, healthy lifestyles, healthy living and workplace. After looking at our risk factors, yes, mental health is at risk in European countries as proven by research and statistics. But now what? What's being done to fight against mental health problems in Europe? Current research suggests that there are 5 key areas that depend on action to improve mental health. These areas are labor market programs, family support programs, alcohol control, mental health care, and debt relief programs. Let's take a closer look. Active labor market programs help the unemployed find work. These also include employment training programs for youth and help for those with disabilities. European studies show this program improves mental health. Family support programs help families strain that may lead to family violence or child neglect. These programs support costs of children and other dependents and provide support for maternity and parental leave. Control of alcohol prices and availability reduce consumption and harm from alcohol and also reduces deaths from alcohol. Primary care of people at high risk of mental health problems requires protecting mental health spending and meeting the needs of the population. It is important to focus on the early detection and increase mental health access. Debt relief programs help with the stress of excessive debt. Debt advice helps people improve their financial situation and mental health. With active labor markets, family support programs, alcohol control, mental health care, and debt relief programs, mental health in Europe will be improved.